When you're talking about earlobes, it's all the way from a little bit of a stretched out hole where people are like, my earrings, my posts point down to the ground versus my earring slides all the way through my earlobe, my hole, and I found it in my bed, to, people who have gauged their ears, which is, putting in a small spacer and just, increasing the size. And you can make that happen a lot faster by making little cuts on the inside of that hole and putting a bigger spacer in. So you have some real thick scar in some of these gauged ears all along the inside of that hole. So people think earlobes are pretty straightforward, but boy, they come in all shapes and sizes and all different issues. So for the little earring pointing to the ground, a little bit of filler in the whole bottom half of the earlobe, just to support the bottom half of the earlobe, the earring will point straight forward and it lasts 2 years in the earlobe. I mean, there's nothing we do out there to break down the HA. So it doesn't take very much filler. So that's the very minimal earlobe issue, up to just stretched out. So we just have to core out the hole and sew front and back together, which is pretty straightforward. But again, you're lengthening the earlobe. So you have to look at not making a longer earlobe. So you have to orient the direction of your closure to make sure you're getting a nice contour of the bottom of the lobule. But then you have torn from pulling their sweater off to their baby pulling out a loop, so you get the torn earlobe. That's pretty straightforward. You have 2 edges of skin that you have to recut, and obviously, most important, lining up the bottom of the lobule perfectly so that it has a beautiful contour. But I call that a pie cut. You're just cutting the edges and sewing it back together front and back. Then we get into the gauged earlobes, and that's origami. Well, the filler obviously is just done in clinic, but the coring out, a stretched out hole, and the pie cut and the gauged ears are all done in the procedure room under local anesthetic. A couple little bee stings in the earlobe. The earlobe numbs up beautifully. I prove to the patient they won't feel anything, and we sit and chat, and I get them fixed. So a couple bee stings in the ear for just the stretched out hole, core it out, repair it front and back. For the pie cut, same. For the origami, I typically just cut the stretched out piece first, and you are really just trying to orient. I mean, stitches go in, stitches come out. Things are back cut to slide, and you're really just trying hard to get a beautiful border of the lower lobe without a bunch of thick scar ending up. Because what happens is you get a lot of small incisions right where you want to then pierce a new hole. A lot of these people want to then have a normal ear piercing, which I like because it's going to hide some of the scar. But the gauged people, a lot of them don't want to re-pierce. So it becomes even more important to try and get the scars to land, up on the upper part of the lobe than smack in the middle of it. So you're just using tissues to get it together looking good. And then you got to match the other side. Again, the cord out will take 45 minutes or so fully. With origami, I'll schedule them sometimes for 2 hours. We truly are able to sit and chat for an hour or two, and I visit with my patients a lot. We have a lot of fun, and we always do a full evaluation of their last treatment. If anything's bothering them, we kind of do a little quick assessment and try and do that at almost every appointment. The stretched out hole and the pie cut, they are very straightforward. I mean, a couple stitches on both sides of your ear. I put a flesh-colored Steri-Strip over it, so it just is brown. I mean, a lot of people they come in a week later to get the sutures out, and those Steri-Strips are still there, and it camouflages all the sutures. Take that out, take the anterior, I put nylons in the front part of the lobe and dissolving sutures in the back. So I snip all those out, usually put a Steri-Strip on again, just because anytime you take sutures out, you render a wound a little tenuous. So putting a little Steri-Strip over it protects it from pulling your shirt off. You can put tension on your earlobe in a strange way. So I always like to protect them still for another few days. And then, I they use a little silicone gel for the first 6 weeks, kind of massaging front and back, and they come back at 6 weeks. And if we're going to re-pierce, we re-pierce. Take some photos. Try and get them back at 3 months and 6 months for photos. It changes people's lives. I tell you, a lot of times, I mean, we all do things at different phases in our life that at a later phase we're not, don't feel it was the greatest choice. So these people are super happy to get back to normal ears. I mean, there's a lot of stigma that goes with a gauged ear, and sometimes you change, and yeah. The only way to get insurance to cover this is if, when your baby pulls your earring through and it's an open wound and you're bleeding and you go to the ER, and then it's a matter of, will the ER doc pay really good attention to the to the lobule border? Because if you just repair a tear, a lot of times it turns up a little bit and you get a little bit of either an up little dent in the bottom of your earlobe or pointing down. And no one wants an earlobe that points down, has a point in the middle of it, doesn't have a nice rounded border. So you really have to pay attention to those kind of things. And I mean, I think most times when people's ear gets torn, they're not in a place where they're going to go to an ER and things. I mean, so usually it's healed and they're coming to get it repaired. At that point, insurance is going to consider it fully cosmetic. There's no functional issue. You need to have a pretty earlobe, so it becomes private pay. The cord out and pie cut, I mean, it's typically about $1,000 for both. When you get into the origami, there's a few different prices. I kind of base it on how long I think it's going to take me to do and how much we're going to have to refine. Sometimes I do little, very small revisions where there's just a little area that the scar got a little thick, there was a little too much tension on it, or there's a little redundancy somewhere, something didn't heal perfectly, where I'll just do a little teeny nip, snip, put a suture in it. So if I kind of know it might end up being a 2-stage, some of these that have been cut on the inside, they're just more difficult. And so if I feel like I'm probably going to end up doing a second little revision on them, it can go upwards of $2,500, but I include all that, even $3,000 if they're. But sometimes it ends up being 3 hours of time on their ears. So sometimes when people come with the stretched out ear piercing, I go into the whole earlobe reduction talk, because if you have long stretched out earlobes and a long, pulled hole that's vertical, if you just go repair that, when you make something round into a line, you lengthen it, right? So by repairing that, you're even making them longer. Now you've got the long floppy earlobes, and that's not the most attractive. So we get into a earlobe reduction, which at that point you have to take out tissue in a vertical orientation and a horizontal orientation. So you have to shorten it in height and shorten it in width. So it's a different pattern. It's a little more thought. It's all that. So yes, that definitely comes up. I'd say maybe even as much as 30% of the time in an elongated, stretched out hole. You start talking to them, and it's like, oh gosh, yeah, my lobe is almost as, it's a third of my ear. It doesn't need to be that long. And so then it's a different conversation. And yes, it's a pattern. You draw on the earlobe, you measure things out, how much height you want to take off, how much width you want to take off, and you draw this pattern on the lobe, and you cut through and through and take out tissue in both orientations and close it up, and they have a nice shorter lobule. You also most people don't want a pixie lobule, which, is coming in strong and tight to the side of your cheek and attached, You want to have a little bit of a rounded lobule border. So I get pixie ears coming in. How can you lengthen this? That's hard. That's a much harder one. But there are some advancement flaps that you can, back cut the skin up higher on the auricle and slide the tissues down and get a little bit of length. I learned those techniques in when I was doing Mohs closures, a lot of Mohs closures, because a lot of big defects on the ear. You can deglove a lot of the cartilage of the ear and move that skin in all directions. The ear is really a fun anatomical structure.